As Omicron spreads across the country, Americans look to move on from trying to stop the virus to treating it and living with it. So what are some of the practical steps to do that? We're going to be talking a lot about this, folks. Dr. Frank Contessessa, he's an internist with Northwell Health. He joins us now. All right, Dr. Frank. I had COVID last week. That's why I wasn't here. My colleagues all pitched in to help, which I really appreciate. One of the things that I know that I am feeling, and I'm hearing this also from a lot of other people, is this post-COVID fatigue. A lot of people who are getting and recovering are feeling it. Talk to us about, first of all, why people feel so tired following even a short Omicron illness.
Sure. First of all, thanks for having me again, Tom. And I'm glad you're doing a little bit better.
Thank you.
So yeah, we by and large with Omicron are seeing what looks like a common cold, maybe like a bad cold. The worst of the symptoms are usually the first few days. Then it starts to get a little bit better after that. Yes, you're right. There is sort of a post-COVID fatigue. It can go on for a week or two sometimes. You know, people will be feeling okay and they say, wow, I don't feel too bad. And then all of a sudden, wow, I think I have to go take a 2-hour nap.
Yeah.
And then you feel okay for another few hours after that. And that's a common pattern. I myself had the same kind of pattern. I had COVID, probably Delta back in Thanksgiving time. But yes, I'm seeing that with a lot of patients.
So, Dr. Frank, talk to us what we do about it. What are some of the practical steps? And I really want to talk practical steps that for patients, for people recovering, what can we do to kind of rebuild that stamina following infection?
Well, there's a couple of things. First of all, I haven't really seen too many people emphasize these things. Vitamin C, vitamin D, and zinc. When you first are diagnosed, even for prevention, there's some anecdotal data. It's not really solid data yet, but these are fairly harmless supplements that can boost the immunity, speed your recovery times, and there's really no harm in trying them. We're looking at about 1,000 units to 2,000 units of vitamin D, 1,000 or 2,000 milligrams of vitamin C, and about 50 milligrams of zinc, and that can help. And then really, it's just time. Your body's just going to take time to recover. If you need a nap, take it. If you need to rest. Don't overdo it. Sometimes people rush to get back to work, and they overdo it, and then they just really feel terrible for even a longer period of time.
Admittedly, I did that this week. I felt, because I'm not good at just kind of sitting in bed. I'm not good at being stuck in the house. And I think I pushed it one day, and I came home and I said to my wife, I feel totally exhausted. The other thing, too, is in addition to kind of listening to your body and getting sleep, talk to us about the importance of nutrition and hydration on the tail end of this.
Sure. A lot of times with COVID, people do get fevers, although we're not seeing the high 102, 103 fevers with Omicron that we were seeing with the prior forms. But people are very easily become dehydrated when you have a fever. You lose fluid about twice as quickly just through the skin and through the pores and through breathing when you have a fever. And you may not feel thirsty to the point where you have to down fluids, but you really need to stay ahead of the fluids. So when you have a fever and you're homesick, you got to push the fluids, even if you don't feel terribly thirsty. From a nutrition standpoint, there's nothing really that's proven. It's really just healthy eating and clean eating. Going forward, people need to eat a healthy diet because obesity is a huge risk factor. So eating a healthy diet is always good advice.
I want to point out, we've been talking about that. CNN apparently just figured out that obese people are the ones who were dying from this illness. But we've been talking about healthy eating and exercise and things like that here on this network for 2 years. Real quick, Dr. Malone, one of the inventors of the mRNA technology, did a podcast with Joe Rogan. I'm sure that you've heard about it. It's been watched tens of millions of times. And he talks for the need for therapeutics. That isn't exactly what the White House is saying just yet. Just give me 45 seconds. Do you feel like it's time for us to broaden our strategy here?
Yeah, for sure. First of all, I'm a fan of Dr. Malone. I think he's brilliant. I watched the podcast and I've listened to a lot of what he has to say. From a therapeutic standpoint, we need more monoclonal antibodies. The GlaxoSmithKline product, the sotrovimab, which has been shown to be effective against Omicron, is in very short supply. I'm not having a lot of trouble getting it for my patients, so we need more of that. I have just a brief word about the oral antivirals that have been approved recently, the Paxlovid and the Molnupiravir. These are not going to be a huge deal that they've been made out to be because, number one, we can't get them.
Yeah.
They're in very short supply. And these are going to be really for the highest risk people.
Yeah.
So for the average person, the average 30 or 40 healthy-year-old person who is going to call me and say, hey, I just got COVID, can you prescribe these medications? It's not for you. There's a lot of side effects, and they have a lot of drug interactions, particularly in these older people who are taking them.
All right, we're going to continue this conversation our next time. Dr. Frank Contessessa, thank you so much for being here.